Blood draws are one of the most common invasive procedures conducted in a hospital. They're also cited by many patients, both adults and children, as one of the most negative parts of their hospital or emergency room visit. Here to tell us more about how the medical community is working on making it better is WSJ's Assistant Managing Editor, Laura Landro. Laura, great to see you.
Great to be here.
Tell us about some of the new innovations in, what is it called?
Ouchless.
Ouchless medicine.
Yes, yeah.
Especially in this one category.
Right. Well, you know, there are 2.7 million blood draws every day in the United States. It's the most common medical procedure, and as someone who has had to go through so many of them in my life, I never get used to it. They hurt.
They do.
They hurt, and it's almost impossible to make them not hurt. So there's a big effort to try to do something about that.
And now there's even a needleless blood drawing device?
Right. Well, you never get away with not having any needle. When you go into a hospital or an emergency room, one of the first things they'll do is they'll put an IV in your hand or your arm, and once that goes in, it's a soft tube. But what they've invented is a company called Velano Vascular. They've invented a little device that goes in there and allows you to draw blood from there, which hasn't always been possible in the past.
And what about topical numbing? Are they doing that more and more now?
More of that, yes. This is a very new device. It's just in kind of pilot right now. Okay. But it's approved by the FDA. But a lot of times with kids, they'll put like a numbing cream. It's got a lidocaine in it. And so they will give it a little time, and then they'll do what they call the venipuncture. The name even sounds scary. But
it does.
You know, they'll give you something to numb it. There are other little devices that they'll use to try to get children distracted. You know.
And why are healthcare providers focusing on the pain management so much right now?
Well, I think they're starting to understand that patients really hate it. And, you know, patient satisfaction is a very big deal right now. There are all these surveys, and pain, did you control my pain adequately, ranks pretty high on those surveys of satisfaction.
I can imagine, especially so for children. And so even in pediatric medicine,
right.
This is a big focus now, isn't it?
Right. And also, like, for example, instead of giving an IV pain medication, they now have these atomized nasal sprays for drugs like fentanyl. So they just put a little thing up your nose and spray, and it's very fast acting. So let's say a child has a broken bone, and they have to get into the X-ray machine and be maneuvered. You know, you go to places like UCLA, Santa Monica Medical Center, children's, are treated that way. Stony Brook Medicine does this. A lot of hospitals are doing this now so that the kids don't have to go through that horrible pain while they're being just examined.
And that old childhood standby stitches.
Oh,
even
yes.
Stitches aren't as painful as they used to be.
Right. Well, they now use a special kind of glue, and it kind of looks like a purple when it first goes on, so kids are like, oh, purple. and it can actually, it's been shown to heal wounds, many wounds, with the same effectiveness as stitches.
I have to say, being a parent of 2 boys, we've been to the emergency room many times for stitches, and we've had the glue the most recent visit, and
yeah.
It was much better.
Yeah, it works.
No needles necessary. Well, Laura Landro, thank you so much for all that.
Thank you.